All I remember is I was just screaming for help, somebody to call my dad, and just help me. Somebody just help me.
Joie is my sister. I was 13 years old when she was born, so she's like my child. Our mother passed away. I kind of assumed the role and helped with my niece and nephew, which are Joie's kids.
I met Joie, she was 15 or 16 when I started dating her dad. She's a quiet person. She's always been quiet. And it's funny how we never realized that it was a quiet strength. She's strong. She's always been very independent. She was always very proud of the fact that she supported her kids on her own.
I've always called Joie my sister. She's my best friend, but she's my sister too. We were raised very close together, always hung out from our teenage years to this day. It was just something, and like I said, since we've been kids, inseparable.
A Pensacola woman will spend life in prison after setting a Circle K clerk on fire. The clerk was taken to the hospital with life-threatening injuries but survived.
So my day started, I got up, got my kids ready for school. I went to work about, I believe it was 8 o'clock. So I came back to work from getting lunch. There was a long line at the register, so I went in around the counter, put the stuff on the table, and I was gonna help get the line down so we could eat. And I walked to the register and I said I'd help who's next. A girl was at the cash register with an open gas can and just starts dumping it on me. I backed up away because she had got gas in my eye. So I went to the back. I was gonna use the sink and try to get out my eyes. Didn't make it that far. When I turned around to look, the offender was at the back door with a lit match and she just threw it on me. My manager at the time, I think she tried to maybe like pat me or try to get the fire to stop, and then that didn't work. She got burned a little bit. A bystander, just somebody that came in the store, he said his first reaction was God told him to get the mop bucket and dump it on me. And that's what he did. And the fire wasn't all the way out of my legs, so he got the actual mop and patted me with it to make the fire go out. I don't really remember anything after that on that day.
I got a phone call from my husband, and he said, we need to go to Pensacola. It sounds like someone set Joie on fire. And my daughter heard that and looked at me, and she got out of the car, and I raced home, and we now know he had gotten a phone call from a Good Samaritan who was there with Joie. I think that Joie must have had the wherewithal to give this man her dad's number because Joie didn't have her phone. Somehow they got a hold of Dan, so she somehow gave this man Dan's number.
I was at work, and my niece called, Lexus, Joey's daughter, and she said, I heard something bad happen. So I got on social media, I seen there was an incident. I told my boss, I said, I gotta go. First, I believe they took me to Baptist Hospital, and they took, I know, at least 95 photos in probably the whole 30 minutes I was there. After that, I don't think I was awake for maybe 2 or 3 weeks after that.
Initially, what was kind of weird is she didn't look that bad. Her beautiful long blonde hair was singed black. They said, we're gonna take her to USA. Unfortunately, that night there was really, really bad weather, and there was actually tornado watches in effect, so they couldn't take her by helicopter. So they took her by ambulance to USA.
We knew that there was a patient that was coming in with burns. They were coming over from Florida and that they were intubated. That pretty much sets the stage for us, and we kind of understand that this is a serious issue, that preparation has to go into preparing for the patient prior to arrival. And so that's what we typically do and did in this case. Joie had burns to her face, her neck, her torso, her arms, a pretty extensive burn. We classify burns based on the depth. And so she had really deep burns, and that can have a huge impact. It makes a big difference on if it's a superficial or a deep burn.
It was a parent's worst nightmare. You just don't expect that phone call. Other people get them, but you just don't expect that phone call. One of the doctors sat with us and they took us into the room where you figure this is not the room you want to be in. And she just kind of leaned forward and said, the next 72 hours will determine whether she survives or not. That's when we learned that she had second and third degree burns over 33% of her body. And we know now that is life-threatening. That is absolutely life-threatening.
As a mom myself, it's incredibly difficult, and I don't pretend to have been in her position, but I imagine it's incredibly difficult.
I didn't realize how bad it was at first. The first day it happened, I didn't go in and see her. Lexus and Brandy went in, and when they came out, it was very you could tell it was bad.
I pretty much was at the hospital every day. While she was in there, I took leave from work and stayed over there so my dad could help with her kids and keep them in school. Just seeing, going in there and sitting and her just being unconscious on the machines and things like that, it was unbelievable that somebody could be so violent and horrible.
They put her into a coma fairly early on, so she never spoke until weeks later. It was weeks.
She had 3 episodes where they had to bring her back, and that was a lot.
When we do skin grafts, there are a lot of things that we have to consider. One of the biggest ones, and particularly in this case with Joie, is what part of the body are you grafting? You're thinking about really functional areas, and so you don't want to put certain grafts on that will cause difficult in mobility. Many of the skin substitutes that we use as the bridge to getting to skin grafts come from either donors or other products that are available to us. In terms of the final skin graft, that does come from the patient. We would harvest her skin, take it at a level at which it would heal, and then using that skin to cover the areas that wouldn't heal on their own because they were too deep.
While she was still on the vent and unable to respond or participate, I presented at the bedside every day to perform range of motion exercises, really just to maintain good joint mobility, prevent deformities, and maintain good functional position of her hands due to the severity of her burns. Another big thing that we worry about is infection, and so infection of the wounds, because our skin is sort of our barrier from all of the bacteria that live amongst us, and when you don't have that barrier, you're at super high risk for infection. So it takes that level of critical care to get through a burn such as she sustained.
Multiple surgeries over the first days and week or two. 8 or 9 total. The skin grafts, the initial ones where they use the cadaver skin, they explained that to us, which is something we didn't realize because it's the best Band-Aid in the world. It can't be used permanently, but they use it temporarily after she's had the skin graft surgery.
The burn team talked with each other and they made a decision to begin weaning her off of sedation. She became more alert and aware of what was going on, so she started to be able to help with the exercises. Before long, she was extubated and really ready to go, more appropriate for more aggressive therapy.
Once she came off of the ventilator, then we were able to communicate with her and talk about where she's been, everything she's been through, and what the road ahead looks like in terms of recovery from her injury.
I could walk a little bit when I left, USA, and that was my main goal. I did have to do like some physical therapy for my neck because it was really tight.
With Joey, I know we had initially started seeing her, she was having a pretty hard time swallowing. She had been on the ventilator for a while, she hadn't had anything, those muscles were really weak, her voice was still really weak. So with that, she was not able to swallow safely. I know she went back for some additional surgeries, and that kind of prolonged us being able to work on swallowing, so we had to kind of take a break. Once she was able to come around again to get to a point to try to swallow, we then jumped back on board with her, in which she made a pretty quick recovery after a couple of days of us then trialing things again. She was able to be put on a diet and be able to eat and not have to rely on a feeding tube for nutrition.
The burn department, specifically Dr. Bright, referred her to me to see if the laser would treat that area and give her more range of motion of her neck. We did about 9 treatments with the laser. She had a pretty good outcome. We still had a little bit of constriction in her neck where she couldn't elevate it as well, and so we actually did a surgery called a Z-plasty to just orient the scar instead of in a vertical fashion to a horizontal fashion. We have the newest technology with the CO2 laser, which we're pretty happy to have, so we don't have to put the patient to sleep. We're able to just use topical numbing medicine, and we numb the area for about 30 minutes. It basically evaporates the outer layer of the skin, basically break up collagen. So if you have any kind of scar or anything like that you need to break up and give yourself a stronger range of motion, you're able to do that.
When I first started with Joey, it was gentle nerve type of work. The goal was to bring relief to where her tissue binds. The hands where it got really ropey, to smooth out that ropiness, to bring blood to the area to help all that nourish.
She really was eager to return back to her normal baseline. I think our limiting factor would be pain. She had several surgical procedures, and so each time it almost felt like we were starting over. She stayed in it and she didn't give up.
She really showed her strength and her ability to overcome such a terrible thing, but with grace. I can't speak positive enough about how she came through everything that she's been through.
To be able to eat and drink is something that is motivating. It's something that gives people pleasure. Being able to go out to eat with friends is something that we do socially, so not only for pleasure and nutrition, but also for social things. So, being able to eat and drink to her was something that was very motivating. She had a really good outlook on things and was motivated to get better and get back to doing things to make life normal again.
Joey and I became very close friends. An hour and a half, 3 times a week with someone, that's a lot of undivided attention, and I value every minute I spent with her.
I'll never forget the day I went in to visit her, and she was sitting there and she just looked at me and she smiled. I could tell at that point she was kind of off of a lot of what she had been on. Of course, her hands were bandaged up. I fed her sandwich. That's the day she really carried on a conversation, and I knew then, I was like, she's gonna be okay. I was so relieved to go home. My dad, Dan, he did stay with me and my kids for about a month when I came home. I wasn't able to do a lot of stuff in the beginning, like they didn't want me in the sun and excessive coldness, but now I'm able to get in the sun. I love going to the beach, being in the water. I love all that stuff. I like being outside.
It's real happiness and joy that, I like to tell my patients, like, you're graduating. That's a huge feat, especially with all that she had been through. Definitely a huge feeling of joy to see her go, but you do get attached to patients. And even though, like, you're rooting them on, they really become a part of the family. So though you wish them well, you're always thinking about them even once they leave.
Joey gave me strength. She was grateful to be alive. She was grateful.
Thank you is so inadequate. But I thought of something. I grew up watching Mr. Rogers. And there's a quote that I've always seen, and he said that when he was a child and he was afraid, his mom would always tell him to look for the helpers. And they would always see people helping. And not just because of the horrible injury, but because of the nature of how it happened. We were in a very dark and angry place. And the staff at USA brought light to us. Seeing those helpers was what got us through. when we doubted humanity, that someone could do something like that to a stranger, it was easy to get angry. And when you go to USA and you'd see these selfless doctors and nurses and staff who were working so hard to help also a stranger, just like Joey was a stranger to the person who did it, it just brought back our faith in humanity. It was huge to us. It was the helpers. The helpers were there, and we can't possibly ever repay that debt to them. We just want them to know how much we appreciate them being a light during our darkness.
Just thank them for saving my life, because if it wasn't for them, I don't know, I probably wouldn't even be here today.